Hi, I'm Bob Lutterer, and welcome to Pharma Research Video Report, where pharmaceutical, healthcare, biotech, and medical device market researchers go for news, insights, and commentary about their industry that they will not find anywhere else. Let's get started. Spending on health services, notably prescription drugs, increased last year, and that reverses a decade-long U.S. trend, according to IMS Health. Spending on medicines was up 3.2%. Now, that's nothing close to the double-digit increases that were the norm earlier. However, prescription spending had been down 1% as recently as 2012. Driving these higher costs were new medicine pricing, price bumps on some branded drugs, fewer patent expirations, and the first rise in healthcare services back since 2009. There were more doctor visits, hospitalizations, and volume of filled prescriptions, which caused IMS Institute of Healthcare Information Michael Kleinrock to comment that it took much longer for healthcare services to recover from the 2009 recession than the economy in general and many other businesses. The rollout of the Affordable Care Act may lead to further jumps in healthcare spending this year, and beyond that, there may be new spending in red states that so far have rejected the Affordable Care Act's Medicaid expansion. A report from Healthcare Daily Report outlines independent initiatives in many of the 23 states that have opted out of state-run healthcare exchanges and Medicaid expansion. Michigan, Pennsylvania, Indiana, Iowa, Utah, and Wisconsin have announced plans of their own. Each of these states will seek a waiver of Affordable Care Act requirements so that they can then proceed and offer private health care plans for those eligible for Medicaid. These eligible enrollees, all above 100% of the federal poverty level, would pay some premium or copay. It's estimated that there are 5 million people who fit that profile across the country and who are without health care coverage. Next, in March, PRVR highlighted the effort of vitaTrackr's Brian Baum to attract the wide variety of companies in the healthcare marketplace to come together and agree on a way to share their respective data for everyone and the industry's economic and other benefits. If carried to fruition, it would be a boon on multiple levels. Baum spoke to us about his progress thus far. Brian, what is vitaTracker?
vitaTracker is a marketplace for the healthcare industry to move data, health data, from the point at which it's created to the destination, to the user of data. So we facilitate the connection of the two parties. We also facilitate, intermediate the consumer's authorization for data transfer. And finally, we transfer value between the parties. So the buyer pays a transaction fee, part of that fee goes to the source, and the balance is retained by vitaTrackr's.
Okay. We explained a couple of weeks ago on our Pharma video why this makes all the sense in the world. But your company is 2 years old, and you're taking on quite an enormous and challenging task to begin with. And then there's the factor in my mind of this, if you'll excuse the expression, upstart company trying to pull everybody else in the industry together for their benefit.
Right.
But a company like yours doing it, are you running into problems just for that reason?
Interestingly enough, at this point, no. What we've seen is there's really no current industry participant that can create what we're creating, because everyone is competitively conflicted. So if one company within one sector were to try to do this, getting their competitors on board would be very, very difficult. If one sector came up with a process that worked in their sector, it wouldn't address the needs of the other sectors.
How many companies and how many sectors are we talking about here?
Well, what we've invited in setting up the marketplace, we've invited 66 companies across 9 different sectors, and we see those as the initial foundation of the marketplace.
Okay.
And so we're anticipating ending up with about 20 companies in our consortium.
Okay. Um, are there obvious within the 9 sectors that are jumping in feet first and saying, "Yeah, let's get started"?
Yeah, it's, I think we've probably caught the industry a little off guard, like, who are you and what is it you're trying to do what? So to your point, but everyone is looking at this challenge of data, of how do we optimize the use of it? How do we bring healthcare to the point where it's as efficient as financial services or other industries that have, made such strides in the use of data? So, they're looking at it where they're trying to figure it out and put it in a box, but they're also intrigued. And, industries like medical devices, pharmaceutical, the device companies are really looking at how do they get the data from their device more broadly integrated into the delivery of care, research for care. And so they're looking for answers like this. Pharma is trying to reduce the cost of trials, easier access. So, people are looking for answers, and I think this has been somewhat intriguing to them.
Okay. And in those 9 sectors, are there some that are playing more of a wait-and-see attitude about this?
Yeah, I would say so. I think, there are the first movers, and that'll be key to this whole model. I mean, we're looking at market momentum, the network effect. As one company comes in representing one sector, that gets the attention of the others. So those that I think are probably first movers, as I said, pharma, med device. Those that are probably going to be a little bit lagging are the providers, maybe the EMR system vendors.
And why, in those last 2, why would they be kind of sitting back and watching?
Well, from a provider point of view, I think that historically, they have used their data set, the data that's developed within their institution, as a competitive advantage. And so the notion of potentially sharing data is it's the antithesis of the way that sector has operated. On the EMR side, it's a similar dynamic where EMRs have been deployed, billions of dollars have been spent, and there's a competitive dynamic where, my system provides better functionality than this system. Well, if you have to interconnect all of them, you start to normalize that benefit.
Mm-hmm. Is this going to be an extremely costly initiative for these participants to get involved in?
No, by pooling the resources, the 20 that end up participating with us will be co-owners, will be investors in us. By spreading this across 20 organizations of the magnitude we've reached out to, the cost, the investment is really minimal to build this, to put it in place.
Okay. Brian, final question. When do you think you might have something functional?
Well, our intent is not to invent or create technology. We are a market maker, a market organizer. So we're using platforms, standards that already exist. So from the time we form our consortium, we would anticipate within 6 months we'll have our first application up and running, and it will be a nationwide application.
And when do you think those 20 some odd companies may get together and form officially that consortium?
Well, one of those that we're talking with suggested that we put a deadline on it. So that was a very good idea. So we've established May 15th as the date that we will close out this invitation. Okay. Because you've also gotten many inquiries from companies we didn't invite and even expressions of interest from other countries.
Well, come May 15th, I'd like to get back together with you and see how you're doing.
I would enjoy that.
Our thanks to Brian and good luck. That's this week's Pharma Research Video Report. Sponsoring Pharma Research Video Report is inexpensive and easy. If you email info@rflonline.com, we can give you all the details on how you can come on board. We'll see you on the next Pharma Research Video Report, and until then, have yourself a great week.